afternoon, ladies and gentlemen. Good afternoon. I'm Paddy Tillett, President of the City Club. It's with great pleasure that I welcome you today on this, my last day as City Club President. Before we proceed with election of officers and governors for the 2002-2003, I have some announcements to make. Next Friday, June the 14th, join us for a special forum that will give you the lowdown on channel deepening. Our speakers are experts in the field. One is our own City Club past president, Ogden Beeman, CEO of Ogden Beeman Associates. Ogden has been involved in regional trade and transportation issues since 1960, when he began working on navigation projects in the Lower Columbia River. He's also worked on port and navigation projects in 20 other countries on 5 continents. Joining Ogden on the dais will be Paul Bingham, principal with Dry Wafer Company. Mr. Bingham specializes in economic analysis of domestic and international freight transportation, and that will be here at the MAC. You have on your tables today, and will receive shortly in the mail, the club's 2001 annual report. Please take the time to read through it and note the amazing number of high-quality programs, research efforts, and new programs that have been completed this year. It really has been a bumper year. I want to extend thanks to all of our active members and to the City Club staff for the high quality of the report, and especially Communications Manager Stephanie Stevens, who wrote much of the text, designed the report, and pulled the whole thing together. Terrific job, Stephanie. Thank you very much. To begin this year's annual meeting, I first want to introduce Carol Witherall, member of the Board of Governors and co-chair of the Issue Committee's chairs. She has some important presentations to make. Carol?
Thank you. The Issues Committees of the City Club give us an opportunity to delve into issues of civics and politics and environment and arts and healthcare and business and technology and growth and environmental management in ways that go beyond and go deeper than the Friday forums. So it's an opportunity for people to join together in engaging discussions of issues of our time and to invite speakers and panelists to come and talk with them about those issues. Out of those committees often come recommendations for research projects or Friday forums. On this occasion, we have 4 committee members who are 4 chairs of our issues committees who are leaving us, and 2 of them are not able to be with us, but I wish to extend thanks to those 2, Joan Hoffman and Rachel Stein, who are co-chairs of the Arts and Culture Committee. 2 of our retiring Issues Committee chairs are with us, and I'd like to extend special thanks and a plaque to each of them. Marcus Simontel, who has been chair of the Growth Management and Environment Committee, and Bill Kramer, William Kramer, who has been co-chair of the Health and Human Services Committee. So would Marcus and Bill come forward, and thanks to all of the Issues Committee chairs for your wonderful work this year. We appreciate it.
Thank you, Carol. Before we proceed with election of officers and governors, I want to recognize the outgoing board members who have served the club so well, not only in the last year, but for the past 2 or 3 years in many cases. As I read your names, please come forward and receive a token of our appreciation. First, Kurt Kraus, completing a 1-year term, has served as co-author of the Issue Committee chairs. Kurt? He's here somewhere, I know he is. Well, in your own time, Kurt. Jane Cease has served as first vice president of the club and served valiantly this year as chair of the research board. Jane, yes, can you come up round this way? We try and make it very difficult for you. Stephen Schneider, who's completing a 4-year term, 2 years completing an unfinished term of someone else, and 2 years as the club secretary. Stephen? Arnold Kogan, who is also completing a 4-year term, 1 year completing an unfinished term, and 3 years term of his own. Arnold? And finally, Dan Finley, who's completing a 3-year term, and I don't think Dan was going to be able to make it on time. He's still not here. Last but certainly not least, I want to recognize our outgoing immediate past president, Harriet Watson, who's not only completing her term on the City Club board this year, but also retiring from her position at Reed College. So my colleagues and I felt that a gift certificate for Powell's books would be an appropriate token of our appreciation for the wise guidance that she's given us. Harriet. In addition to these board recognitions, there are 2 other very special awards to present today, the Member of the Year and the City Club Award. Please come up to the podium and receive your award as I call your name. A year ago, I expressed my concern that civic activism seemed to have become the preserve of the grey hairs and the no hairs, and there seemed to be widespread apathy among the 18 to 34-year-old cohort witnessed by their scarcity at the ballot box. I'd like to lay claim to the amazing resurgence of young members that we've seen in the club during the past 12 months with formation of the new Leaders' Council, introduction of younger members to the committees, and the staging of new evening programs. However, all I did was to pose the right question to an ad hoc task force of young members and non-members. The initiative of that group, and particularly of its co-chairs, did all the rest. This year, the City Club Member of the Year Award is being bestowed jointly on 2 outstanding individuals. They not only led the task force and chaired the study that resulted in a whole list of recommendations, many of which have already been adopted, they went on to chair our new Leaders' Council and are largely responsible for its outstanding success. Our hearty thanks and congratulations to Heather Kmetz and Gwen Milius. It's my pleasure now to award this year's City Club Award, the highest honour that the club can bestow on one of its members, this time to a very special man and an outstanding citizen. The City Club Award is given to a long-standing City Club member who has provided exceptional service not only to the City Club but also to the community as a whole. This year's recipient has served on the City Club Board of Governors, the Government and Taxation Issue Committee, the Membership Committee, the Growth Management and Environment Committee, and numerous club development and fundraising committees. Ned Look has been a member of the City Club of Portland for 54 years. He was the founding executive of the Community Foundation of Oregon and served on the Metro Charter Amendment Committee. He's been a member of countless community organizations, served on innumerable mayoral advisory committees, and has been the recipient of the George Russell Award. I'm privileged and honored to present this year's City Club Award to Ned Look, whom I've long admired for his wisdom, humility, and tireless pursuit of higher civic values. Ladies and gentlemen, citizen extraordinaire, Ned Look. Ned says he won't say anything because if he does, he'll say too much. In my last official act as City Club President, I'll proceed with the election of the 2002-2003 officers and governors. First, I'd like to introduce our returning members of the board seated in the back row. And they are, from my right here, Colleen Kraft, Realtor for the Hassan Company and Chair of the Program Committee. Doug Marker, Director of the Northwest Power Planning Council's Fish and Wildlife Division, who automatically becomes the club's first Vice President today from his position as second Vice President. Next to Doug is Katie King, Intergovernmental Affairs Liaison for the Oregon Health Division and Chair of the City Club's Membership Committee. Tom Deering, retired partner of Stoll Reeves Law Firm and valued sage. Carol Witherell, Professor of Education at Lewis and Clark College and co-chair of the Issues Committee chairs. And last but certainly not least, the invaluable Ginny Cooper, Director of Multnomah County Libraries and Club Treasurer. Will all of you please stand and let's give them a round of well-earned applause. We'll now proceed with the election of the 2002-2003 officers and governors. To my immediate left is Susan Kelly, who automatically becomes president today from her position as president-elect. Next to Susan is our guest speaker for today, who unfortunately is not being elected to our board. Governor Kitzhaber will be introduced later. Next to him is Marcus Simmental, owner emeritus of Simmental's Farm and Nursery, and nominee for governor. That's City Club governor, I should clarify. Next to Marcus is Heather Kmetz, attorney for the Hannah Strader Law Firm and nominee for governor. Next to Heather is Chris Smith, director of Internet Strategy for Xerox Corporation and nominee for governor. To my immediate right is Gwen Milius, marketing coordinator for WPH Architecture and nominee for governor. To her right is Andy Linehan, senior environmental planner for CH2M Hill and nominee for president-elect. And to Andy's right is Joey Pope, chair of the Portland Parks Foundation and nominee for secretary. And to Joey's right is Wayne Lay, director of environmental affairs for Portland General Electric and nominee for governor. Kurt Wabring, nominee for second vice president, was unable to be with us today. The above nominees have been selected by the club's nominating committee according to the bylaws. There is a mechanism in the bylaws that allows other nominations from the membership, provided that 3 written recommendations from club members and a signed agreement from the nominee is submitted within 10 days of the annual meeting. No other names have been submitted for election. I therefore declare the nominees elected by unanimous consent. Congratulations all round. The board would like to offer its special thanks to Lloyd Anderson, who chaired the nominating committee this year. You have an outstanding board for 2002-2003, and I look forward to a productive and rewarding year. Our success has and will depend in no small part on our splendid staff, and I'd like to take this opportunity to recognize each of them. Nancy Hedin, Executive Director, Paul Leisner, Research Director, Stephanie Stevens, Communication Manager, and Suzanne Jeffries, Office Manager. Thank you very much. I'd also like to say a special thank you to the unsung heroes of the MAC staff who take care of us each Friday. They flit among the tables, bringing sticky buns and whisking away empty plates as we focus on our speakers. Let's give them a round of applause. And with that, I'll hand over... With that, I'll hand over the virtual gavel to Susan Kelly. Thank you all for a busy and rewarding year as your president. Thank you very much.
Patty, it's been a wonderful gift to have you as our president this past year. Your warmth, wit have been magical each Friday program, not to mention the lyrical sound of your British accent. Beyond that visible public role, you have contributed wisdom and good judgment with the many routine and occasional rocky issues that can be expected with an operation like City Club. I can speak for the staff that they have appreciated your immediate availability whenever you were needed. You also gave them support or honest criticism when needed. You have been the faithful champion of the new leaders effort, and it is successfully launched, and we thank you for that. So my 3 words are warmth, wit, and wisdom, and they suit you very well.
Thank you. Thank you very much.
Okay.
Thank you so much.
So I accept this responsibility knowing that I will devote all the energy it takes to reach my goal for the year, which is stable funding for City Club. As you recall, Patty's goal was the new leaders, and he's done an excellent job. So I'm going to be working hard to keep up with him. We have a strong, innovative board. We have new energy with youth, as well as some experienced long-term members who understand City Club values and history from many years of membership. I know with the board and with the staff and all of you members that I have the support to find that stable funding and keep City Club as an absolute integral, important part of this community, and that we'll work together on. So thank you. Our guest today, and we've had so many words so far, I'm going to keep it simple. Governor John Kitzhaber, we're thrilled to have him here at this time. It really is intense if you've been reading the paper the last few days, few months. The only thing that I was disappointed to hear when we were just chatting is that yesterday when I read that the Prince of Negativity, David Reinhardt, says we need to raise taxes, I was so encouraged, but apparently that's a downslide today. So we will hear from Governor Kitzhaber.
Thank you. Thank you very much. Thank you. I also read with great interest David Reinhardt's article and thought it represented the journalistic equivalent of genetic realignment, but was delighted to see it. And I do think that the thrust of his article was essentially right on point. This is going to take a give and take, and I'll touch on that in a moment. I would like to just start, however, by relaying a personal message from your brother Tom. He wanted me to congratulate you on your ascendancy to the presidency. He is unable to attend this afternoon, so on Tom's behalf. I had hoped to use this appearance before the City Club to discuss the escalating cost of health care in general and the cost of prescription drugs in particular. Unfortunately, the state fiscal crisis has deepened significantly, and I feel compelled to spend some of my time today discussing our options and how best we might proceed. Nonetheless, I would like to take just a few minutes at the beginning here to touch on the health care issue, which is a growing burden to both public and private sectors. As you know, the rising cost of health care has put many employers in the difficult position of having to either drop coverage for their employees or to shift more of the cost to their employees through increased deductibles and co-payments. And from an employee standpoint, the cost of health care benefits is starting to squeeze out wage increases and other elements of the compensation package. And I think the key word here is benefit, a term which we have come to view as meaning something of economic value, that is something that's covered or paid for, usually by somebody else. In other words, we view health care as an economic commodity, just like wages or vacation time or retirement. And therein, I think, lies one of the keys to controlling health care costs. Let me start by asking you a question. What would you say the objective of the health care system is? Is the objective to give people access to health care, or is the objective to keep people healthy? I would argue that it's the latter, that health care is a means to an end, but not an end in itself. The objective of the health care delivery system is giving people access to care, but the objective of the health care system is health, restoring, maintaining, or improving health. So health care has no intrinsic value outside its relationship with health. And that means that health care services that don't have a health benefit are not worth paying for if you're an employer, and are not worth negotiating your wages away for if you're an employee. My point is that instead of simply continuing to debate how we pay for the increased cost of health care, we need to be asking first, why does it cost so much in the first place? And second, what are we getting for this huge expenditure in terms of health? And prescription drugs, which constitute the fastest growing part of the health care budget, I think is a prime example. The dramatic increase in the cost of prescription drugs can be traced directly to the 1997 decision by the Food and Drug Administration to repeal the ban on direct consumer advertising by the pharmaceutical industry. As a consequence, the advertising budgets for the major pharmaceutical companies increased from $55 billion a year in 1997 to $155 billion a year in 2000. So today, every one of the 7 most heavily advertised prescription drugs is promoted with a marketing budget in excess of $125 million a year, which is more than Nike spends each year promoting its athletic shoes. And what that does is it creates a market demand for a particular brand name drug with no clinical context. In other words, there's no way for the average consumer, or physician for that matter, to know the relative cost effectiveness or effectiveness of these various drugs that are being advertised. So let me give you an example. I've got a young man that works for me who's very healthy and developed some pain in his wrist, and he went to see his physician and returned to the office with a sample of something called Celebrex and a prescription to fill if his wrist got better. Now, Celebrex, by the way, is one of the most heavily advertised anti-inflammatory drugs on the market, but there is absolutely no evidence whatsoever to suggest that Celebrex at $70 a month is any more effective than across-the-counter Advil at $7 a month in an otherwise healthy Caucasian male with no history of gastrointestinal problems. So the point is that the difference is $68 that provided no meaningful health benefit but contributed to the escalating cost of health care. Now, getting at that problem requires at least 2 things. First, it requires good, objective, evidence-based analysis of the relative clinical effectiveness of prescription drugs. And second, physicians need to use that information to guide their prescription writing practices, and employers, both in the private sector and public sector, need to use that information to determine what they're willing to pay for. Now, as many of you know, last legislative session, we passed over the strident objectives of the pharmaceutical industry, Senate Bill 819, which creates a formulary for the Oregon Health Plan by which drugs of various classes are evaluated in terms of their relative clinical effectiveness. And this evaluation, which is based on peer-reviewed research, is being conducted through an open public process by the Oregon Health Resources Commission, chaired by Dr. Frank Baumeister, who's a former president of the Oregon Medical Association. So one example of a class of drugs would be the non-steroidal anti-inflammatory drugs that I just mentioned, like Celebrex or Vioxx, but also Advil and aspirin. Other examples would be drugs to lower cholesterol, like Lipitor and Mevacor, and drugs to treat heartburn and ulcer, like Prilosec and Nexium, the little purple pill. You must have seen that somewhere on television the last few days. So to be the preferred drug for the Oregon Health Plan, the drug has to be as effective as any other drug in the class, but more cost effective. And the reason the drug companies so vigorously object to this and why they oppose evidence-based analysis is because it forces them to compete on the basis of cost for 2 drugs that are clinically equivalent. A functional marketplace. What a novel idea. That is, after all, how IBM competes with Hewlett-Packard, how Ford competes with Chevrolet, and how Nike competes with Adidas. But creating this kind of functional marketplace is exactly what the pharmaceutical companies are resisting, because their huge profits depend on the fact that consumers have no information about head-to-head comparisons between different prescription drugs designed to treat the same condition. After all, in order to get the FDA approval, you just have to demonstrate that the new drug is more effective than a placebo, not more effective than another drug on the market to treat the same condition. So, the pharmaceutical industry has also vigorously opposed federal funding to support head-to-head research to provide this kind of information, because it's the lack of this information that makes the advertising so effective. Now, can you imagine how difficult it would be for a consumer to make a decision like purchasing a car or an appliance or other products without the consumer's report, which provides objective information by which you can compare products? Well, no such information like that is available in the prescription drug market. So one way of looking at what we're doing here in Oregon is creating the equivalent of a consumer's report for prescription drugs. And armed with this information, which will be available on the internet, consumers and purchasers and physicians can choose the most effective medication, which in many cases may be 5 or 10 or even 50 times cheaper than the drugs that are being advertised on television. So what we're talking about here, evidence-based analysis and value-based purchasing, are also applicable to other stakeholders in the healthcare system: physicians, hospitals, and the medical device industry. And that has huge implications in terms of the escalation in healthcare costs. And I hope that I'll have an opportunity to come back in the near future to address the City Club on this troubling issue of healthcare costs and go into the detail that our state's fiscal circumstances or going to prevent me from doing today. Let me turn now to the challenges facing the upcoming session of the legislature. As you know, the revenue forecast announced last week in conjunction with the defeat of ballot measure 13 in the primary has left us with a projected revenue shortfall of over $870 million for the final year of this biennium. In addition, the revenue forecast and the tentative budget projection points to an additional deficit of over $1.3 billion in the 03-05 biennium. That situation presents us with two challenges. A short-term challenge, dealing with the immediate revenue loss in the second year of this biennium, and the long-term challenge, which is a structural budget deficit that preceded the recession and will continue beyond the recession. In other words, our current level of state programs and services is not sustainable into the future based on our projected revenue forecast, even when the economy has fully recovered. And that projected discrepancy between programs and services and revenue is due largely to some choices that we made in the 1990s. Primarily our choice to cut taxes through ballot measure 5 and ballot measure 88 and the 2% kicker, but not to cut the programs and services that revenue supported. So I'm soon going to call the legislature back into session to address these challenges. And what I'd like to do for the next few minutes is simply walk you through the options that we have and the likely consequences of the choices that we make. I've come today armed with a slide, and I appreciate your indulgence. I also have a light pointer. See, still don't know how to get my email off my computer, but I'm otherwise. What I'd like to do is start by discussing two different decision tracks that both stem from the question, is the state general fund adequate to meet our expectations and needs, particularly as it relates to public education? If the answer to that question is yes, then it leads to a second question, is the state general fund too big? If your answer to that is yes, the solution is to cut the budget further. If the answer is no, the solution is to try to figure out how to maintain the current level of programs and services. I would say that the current level reflects almost a $500 million cut that was taken during the first two special sessions. Now that's essentially where the legislature has ended up, trying to figure out how to maintain the current level of programs and services. And although I'm sure the news coverage of the first two sessions has left you with the impression that none of us can agree on anything, there is in fact a very broad consensus on the cut level. Or to put it another way, there's a broad consensus on the level of state services required to meet the legitimate needs of Oregonians. Up through the first special session, the tentative contemplated cut level was around $450 million. And in the second special session, in spite of a declining revenue picture, that cut level remained essentially the same. Members of both parties, I think, have come to the realization about the serious consequences of further deep budget cuts. After all, 70% of the state budget goes directly back to local communities in public education, in health care, in economic development, and in support for the frail elderly and other vulnerable citizens. So there's a broad consensus that these services are vitally important for our communities as they try to weather and recover from the current recession. So my point is this: I think we have cut the budget about as deeply as we can, not only from a public policy standpoint, but I think also from a political standpoint as well. So what we've been debating is really not budget cuts, but how you pay for that portion of the budget that we want to sustain. And I think that conclusion is further reinforced by the position staked out by both of the gubernatorial candidates. Neither Kevin Mannix nor Ted Kulongoski have proposed additional deep budget cuts. Instead, they've articulated strategies, very different strategies to be sure, but strategies on how to pay for the current service level through the remainder of this biennium. Now let's turn to the second decision track. If your answer to this question is the state general fund adequate to meet our expectations and needs, and if you answer that no, then the solution is to not only maintain the current level of expenditure, but to try to increase it as well. Now I think reasonable people can disagree about the answer to this first question. But I would submit to you that the current funding level is not, in fact, adequate to support our needs and expectations, particularly as it pertains to public education. And to support that point, I would share with you the following facts. Tuition at Oregon's public universities has gone up over 80% in the last decade, pricing many high school graduates out of a post-secondary education. And even students who can afford to go carry an average debt burden of $16,500 out the door with their diploma. Tuition at Oregon's community colleges has increased over 125% in the last decade. And at our current funding level, there will be over 25,000 full-time students in this state who will not be able to attend a community college next year because of insufficient capacity. The Portland public school system, as you know, now has the shortest school year in the country. Condon has gone to 4 days a week. There are schools being closed in Portland, Baker City, Pendleton, Eugene, and Fern Ridge. Oregon City laid off 21 teachers. Klamath Falls has cut 16. Roseburg has cut 4. I would simply submit to you that this picture is inconsistent with what all of us know to be true: the importance of education as the central, critical factor to maintaining a competitive workforce in the 21st century. In either event, whether you want to increase the level in the general fund or just maintain it, you're confronted with the same basic problem: a $876 million shortfall for the final year of this biennium, and then a looming $1.3 billion shortfall in 03-05. Now, the way you approach funding for the last year of this biennium depends on whether you believe this represents a one-time problem due to the recession that will be resolved by a growing economy, or whether you believe it represents a more permanent structural deficit. The legislative leadership has been operating essentially on the assumption that this is only a short-term problem caused by the recession, thus their focus on one-time revenue sources and on borrowing. There is no evidence whatsoever to support that contention. In fact, I think the preponderance of evidence supports the conclusion that this is a structural deficit that is not going to go away when the economy recovers. First, the June revenue forecast that projected the $1.3 billion deficit for the next biennium assumes economic recovery in the third quarter. Second, to grow our way out of this problem would require, that is, to eliminate the 03-05 deficit through economic growth, would require a job growth rate of between 5.5% and 8.5% each year for the next 2 years. And that has never happened in the history of this state. Only once in the last 21 years has job growth exceeded 5%. And that was a 5.1 rate 1 year during the mid-1990s. In addition, independent organizations like the DRI, Wharton Econometric Forecasting Associates, and the Western Blue Chip Economic Forecast project job growth in Oregon in 2003 to be just over 2% or lower. The fact is, we are not going to grow our way out of the budget problem that faces the state today. And our system of public education that consumes 60 cents of every tax dollar is going to continue to be at risk until we add some kind of permanent new funding to the Oregon State General Fund. That's why I have called for a temporary modest increase in personal and corporate income taxes dedicated to education to stabilize our fiscal picture long enough for the next legislature to refer to the voters a proposal that will reduce our reliance on the income tax and provide the long-term stable funding that our schools need and that our future demands. Now, when considering this proposal, which has certainly taken its share of hits in the last few weeks, it's important to remember that $133 million of the shortfall in the second year of this biennium and $250 million of the shortfall in the next biennium stems from financing the income tax cut in ballot measure 88. In addition, Oregonians are receiving the benefits of the Bush tax cut. My point is that for most Oregonians, this modest tax increase will be more than offset by the tax cuts enacted through ballot measure 88 and the United States Congress. I also think it's important to compare the potential economic impact of a modest temporary tax increase with the economic impact of alternatives, particularly deeper budget cuts. First, there are many Oregon communities, particularly in rural Oregon, where public employees comprise the lion's share of the workforce. Look at Pendleton, or Ontario, each of which has a community college and a correctional institution in addition to a public school system. The local economy in those communities depends on the jobs provided by those public institutions and on those public employees spending their dollars with local businesses. In addition, allowing our system of public education to further deteriorate will surely jeopardize our ability to attract new industries into our state. Now, I appreciate that what I have proposed is not popular, and I assure you that I would not have proposed it if I did not believe that it was the best thing for Oregon's future. But to put the furor over this proposal into context, I would remind you of the young man with the $70 Celebrex prescription that I mentioned earlier. I find it ironic and not just a little bit troubling that we are so resistant to spending a few extra dollars a month to support educating children here in Oregon, while we will blithely spend hundreds of dollars each month to boost the profits of multinational pharmaceutical companies. It's something to think about. Let me simply close this noon by acknowledging that there are, in fact, ways to balance the budget for the remaining year of this biennium without using a general tax increase. And in the end, that may well be what the legislature chooses to do. But let's be clear, while it may be the politically expedient course, it is not the road to our vision of the best educated and best trained workforce in the world. On the contrary, it is a road to mediocrity, and I, for one, am not willing to go there. I will continue to argue to anyone who will listen for a different road, for a different future, one that depends on our collective willingness to move beyond partisanship and particularly beyond ideology, and to make these fundamental investments in the future of our Oregon community. Thank you.
Governor Kitzhaber, your championing the health of all Oregonians through the Oregon Health Plan has certainly been one of the most important measures of your leadership as a governor. And whether or not the Oregon legislature finds the means to continue the plan while also addressing the other aspects of our fiscal crisis will clearly be a measure of the legislature's ability to lead. Much of today's talk and the public debate has focused on how we deal with the fiscal crisis of this biennium and the next biennium. But I'd like to hear a little bit more about your thoughts about the long-term solution that you would like to see the legislature address for the bienniums that go beyond the next two, in terms of the fiscal formula that we'll be using to provide health care and education and so on.
Well, I think two things should be very clear from the current recession, which is the first recession post-ballot measure 5. One is that it is not wise to base your educational system on the income tax, which is an extraordinarily volatile revenue source, and you can't just stop educating a generation of kids in this information age during an economic downturn. So we have to reduce our reliance on the income tax. I have in the past supported and championed a sales tax. I got as close as 4-1. I was as close as I got. But I believe that what the legislature needs to put before the voters, there's two challenges in the next biennium, and essentially what I've suggested is some bridge financing so the next governor and the next legislature doesn't walk into $1 billion deficit, which will consume all of their attention, and give them some breathing time to debate two issues. One is the adequacy of the general fund. I mean, how much money do we want to have in the general fund? And that's going to have to address issues like the rising cost of health care or the issues with the public employees' retirement system. Once that has been agreed upon, then the question is, do you want to continue to pay for it with the income tax or change that? I would argue strongly that we need some kind of consumption tax, whether it's a VAT tax, whether it's a modified form of a sales tax, but we have to have something that pulls our income tax rate down and provides us a broader tax base, and we also need to create a stability fund similar to the one that was in ballot measure 13, and I'm hoping the legislature will re-refer at least the shell of that so that we do have some cushion, and then we have to have the discipline to capitalize that when the economy is good.
Greg McPherson, City Club member. Governor, there were two special sessions held earlier this year in which there apparently was not a consensus reached in advance of the session about what the fiscal solution ought to be. My question for you is, will there be something hammered out in advance before you call the legislature into special session?
Well, that would certainly be my preference, and I'm sure your preference also. We do have the answer to that question depends on how long it takes, because there's a couple of dynamics that you will learn about in the legislature. Often it's hard to get closure on issues until you get people right into the fishbowl there. As you know, the Speaker has presented a plan which I think is probably reflective of the majority party's view in the legislature. I've proposed a plan that is probably closer to the Democratic view. I think as David Reinhardt said, I think the truth is the deal is somewhere in between there. We do have to get this done, though, as early in June as possible. July 1st is the start of the second fiscal year, and the school districts absolutely need to know how much money they can count on so they can build their budgets for the school year starting next September.
Governor, I'm sure you're aware of the fine that was imposed upon the Abbott Laboratory drug manufacturing firm by the feds back in September of last year. It was $876 million. Unfortunately, while most of the people in this room know about Enron and its debacle and the harm it's caused the country, very few people seem to know anything about this fine imposed upon Abbott, despite its being almost $1 billion. Now, other firms like Bayer have also been implicated in the investigations of Medicaid fraud. My question to you is how much you think the impact has been on the Oregon Health Plan of this kind of industry-wide fraud.
Well, I think the main impact on the Oregon Health Plan from the pharmaceutical industry has been really strictly a cost issue. Now, to the extent that this contributes to it, that's probably run things up. Just to put it into perspective, the cost of the prescription drug budget in the Oregon Health Plan grew over 60% between last biennium and this biennium. And you know, I can tell you we didn't get a 60% increase in health for that enormous expenditure. So I do think the industry needs to be opened up. I think we do need some clear lines of accountability, and particularly we need to give consumers and the provider community good, objective evidence on the relative effectiveness of these various heavily advertised drugs.
Hi, Governor. Jane Cease, City Club member. I can't resist, standing in the middle of all of these activists, we're all getting tons of requests for help from candidates for both money and, going door to door and things like that. And I'm sort of thinking, well, I don't think I want to give my time or my money to somebody that's going to go down there and be real chicken about voting for revenue and overhaul. But do you have some advice for people about the kinds of qualities that candidates need and that we need to send to this next session, which I suspect is going to be absolutely god-awful to live through?
Well, I will paraphrase Martin Luther King. I think something that is lacking today, and that I think each legislator should have, is something they are willing to lose an election over, an idea or a principle. You can also help by getting on the bus. That's your segue.
Jefferson Smith, City Club member. The presidential primary, the first one, happens in New Hampshire. It is 700 days away, roughly. New Hampshire is about 3,231 miles driving from Portland, Oregon. It's about 61 driving hours. Now, me and my friends, we got a bus. And my question is, you need a ride.
I'm Ted Falk, and I'm not running for anything. I am chair of the incoming chair of the City Club's Healthcare Issues Committee, and we've been engaged in the study of the healthcare safety net, which is the segment of the healthcare system that serves the medically indigent. And of course, one of your goals originally in the Oregon Health Plan was to try to eliminate or reduce the necessity for a healthcare safety net by having alternative funding methods. That really has not been able to be realized, and I wonder what your view is today of the state of the healthcare safety net and how you think that these budget cuts are going to affect it.
The healthcare safety net, and in fact, parts of the other parts of sort of the social safety net are very frayed. The healthcare safety net in particular, we're seeing an increase in the number of people who are uninsured for exactly the reasons we have talked about. It's just as the economy cools, just to keep the doors open, employers who really want to continue to provide that health care are being forced to shift those costs. And I think that one of the things we learned, or at least I learned with the Oregon Health Plan, was that in order to provide the social safety net, I think you have to use a fundamentally different kind of delivery system. What we tried to use was the old, basically competitive market system. And if you look at where the health plan really worked and where it had a lot of trouble, was the difference between where people had a community, sort of a community-centered organization versus the old competitive market model. And let me just elaborate on that. A competitive market model doesn't work for the medically indigent who don't have a payment source or who have a payment source that's lower than people who are commercially insured, because economic marketplaces were designed to make a profit, not to foster social responsibility. So no one's going to compete for the poor. So what the game has been is how do you avoid seeing them through selection, and that's been very detrimental. If you go to Bend had a very, very good program for quite a while where all the physicians and all the hospitals and the community basically said the low-income people are the responsibility of this community. They're not going to go away, and we ultimately can't avoid risk for them. They're going to show up in the ER. They're going to show up in various institutions. We're going to pay for them. So what they did is they spread the cost and risk of taking care of the medically indigent throughout the medical community, primary care physicians, specialists, nurses in the hospitals, and they managed the care. And I think that we need to focus for the safety net less on coverage and more on access. And I'm actually working on a concept that hopefully we can get into the national health care debate, because I think just finding more money doesn't solve the fundamental problem if you don't change the dynamics of the delivery system for that particular population.
Ray Polani, the predictable radical.
You been on the bus yet, Ray?
Well, give me time, it's coming. I don't think there's any question that programs, services, and the quality of life have a cost that must be paid by citizens, i.e. the taxpayers. I think Oregonians need to realize that there is no free lunch. And I have a suggestion for revenue for the general fund. My suggestion goes like this. Let's look at Europe. European countries are paying a tremendous high, relative to ours, gasoline tax. And it goes in the general fund, which means that transportation does not fare any better than healthcare, schools, corrections, whatever the government services are provided. I suggest that it is time to have the courage to go to Oregonians and explain to them that a higher, much, much higher gasoline tax in the general fund would help balance the equity and the funds needed to provide the program services and all the things that we need.
That was a statement, I assume. Ha! Should have left it alone.
There is the question.
Well, I spent most of my first 2 years in office when I was going to run again in 1995 and 97 with the Oregon Transportation Initiative that Neil Goldschmidt chaired, and it was a full court press, and we We had both a gas tax increase and a registration fee increase, and we were also going to modify the Constitution to allow the gas tax revenues to be used for transit as opposed to just paving roads, which is, I think, becoming more and more critical. But we were unable to get it out of the legislature. We finally got one out, I think, in '89, and I think it lost with 80% of the vote. So I support the idea, and we will look with great optimism at the next governor and the next legislature to carry the torch for both of us on that one.
Governor Roger Meyer, City Club member. Have you asked or considered asking the Attorney General to look into the constitutionality of the double majority rule?
We have, our office hasn't, but I believe he has been asked that question by somebody. I think that is one of the worst things in terms of discouraging voter turnout. And if you recall, that was on our ballot once, freestanding, and we beat it significantly. And then it was, I believe, and someone correct me if I'm wrong, I think it was a part of either Measure 49 or Measure 50, which was focused on, and the focus was on the property tax cap portion of it, but not on the measure. I think that if we cannot get it declared unconstitutional, I think we need to get it back on the ballot, because I think it is just a travesty, makes a travesty of the democratic process.
Paul Millian, City Club member. Following Ray Polani, I'm also going to advertise my hopeless optimism and streak of utopianism, but address a public health issue. We have about 2/3 of the, according to national statistics and what the drug czar told us about a month ago, that about 2/3 of the arrests and incarcerations and so on for drug use are around marijuana. We have it's a product, and this gets to your idea about a consumption tax. We have a product that sells for about the same as gold per ounce. And we have a system in place in this state for distributing controlled substances, specifically the Oregon liquor stores. Is there, I'm trying to figure out how to make this a decent question, but is there any hope?
I can see where this is going.
Is there any hope in your lifetime or mine that we might see a system where we could regulate and tax, following a Dutch model? I mean, there are models out there where we could regulate and tax the use of marijuana, and I strongly suspect we would solve a whole range of fiscal problems, because that's another thing that is not going to go away. People will keep doing things to make themselves feel good. So just like your comments on that, if you would, please. Thank you.
Well, I think that it's not an idea that should just simply be cast aside without a larger debate. Gary Johnson, who's the governor of New Mexico, he's a proponent for even more sweeping legalization of controlled substances, or to change the paradigm, because he doesn't really believe the war on drugs has really done anything. It's created cartels and the black market economy. I guess I have some concerns about how it would be done, but it's something that obviously goes on in this state, and we're not going to stop it. It's just like prohibition. I think it's important, however, we don't send a message to young people that it's okay to do that, because marijuana is just like alcohol. Early consumption of marijuana and alcohol does have a relationship to addictive behavior later on. But I think we should have an open and serious debate on that topic. I would welcome it. In my lifetime, I don't know.
Carol Witherall, City Club member. In order to address issues as profoundly important to a democracy as health care and education are, we need to be very well informed as a citizenry. If you could make 3 recommendations for how we can restore our faith in government such that people will read up on issues, read up on candidates, not rely on sound bites, and go to the polls and vote intelligently for candidates and issues, what would those 3 recommendations be?
Well, I can't give them to you in a bumper sticker, but let's just take a cut at it. I think civics, if you will, or an understanding of our governmental process needs to be instilled in children in the public school system more than it is. They need to understand how the tax system works and operates and what it means, and I think that would be very, very important. Secondly, this is, I guess, the real key here. I think we have to try to make government more relevant to people's lives. One of the things that I've discovered, and my mind has sort of evolved on this during my 8 years as governor, is that there are a lot of issues that you can get people engaged in if they're seen as community issues, if that people are willing to engage in place-based problem solving, give of their time and their resources. And I'll give you 2 examples. One of them is the core of our salmon restoration effort, which is the local watershed council, where you have environmentalists, extractive industry folks all working together to solve a shared problem on behalf of a shared place. The Community Solutions Team, which some of you may be familiar with, which is essentially an effort to engage local leadership on a vision of how they want their built environment to look, and the state then acts as a partner. So I think that there's I would carry that a little step further. I think that a lot of the solutions that we apply today are really built on an industrial age mindset, and that we need to begin to try to decentralize in a very meaningful sense by giving more choices and more accountability to people in their own communities, which really matches where the economy's going. If you look at what's happening in the workplace today, it's not people in assembly lines, it's people working in teams. It's a workforce that honors creativity, and I think that the government has to follow that. Third, I would do something with the initiative process. I would not take away people's access to it, but I do think there has to be a better objective filter at the front end so people understand the consequences, the fiscal consequences or whatever of the measures that are being voted on.
Governor. Lou Frederick, City Club member, on my lunch hour. I want you to know that. The reason I say that is because I want you to expand on something that you said just a minute ago when Jane Cease was up. I am interested in making sure that some of the folks who stood in the way of funding lose those elections. That's one of the issues for me. And I'd like to know how you approach the idea of the call for accountability turned around for the politicians and political leaders to provide the services needed by Oregonians. And regarding schools and regarding funding for schools, is the QEM model, in fact, the one that you would approach and one that you would embrace?
Well, obviously, I have some sense of ownership in the quality education model, but I also think it can be significantly improved. But I do think that if you're going to, K through 12 now consumes about 42% of the general fund and growing, and we have to have a much better way to demonstrate to people the relationship between that budget and what we want to happen in the classroom. We created a database. Actually, I think we did it in '95, which was one of the first things that got cut in the first special session, and it's not there right now, but I would say that's critical. Essentially, it allows us to look at the cost of teaching English in Grants Pass High School and compare it to Wilson. I mean, you can see the differences. So we need that data, and then we need some objective way to try to link the outcomes that we want in the classroom to the budget. And I would not let go of that. I think it needs to be refined. It needs a lot of work. It's just a starting point. But if I can use a weak analogy, when we created the first priority list, which was essentially an effort to try to relate the dollars in the healthcare budget to health outcomes, it was pretty crude. And it's gotten quite sophisticated now. It factors in comorbidities and a whole host of other things. So I think if we stay the course on that, and with the Education Act, particularly the Certificate of Initial Mastery, maybe slowing down how fast we implement it, I think we absolutely need to do that. If we throw that away, we're going to go back to the old school paradigm of the 1980s, where you measure success in seat time, not what people carry out the door in terms of real life skills.
Speak to the political issue, regarding the political leaders. Again, I said that I want to make sure that some folks who were not supporting education, that they are held accountable for that as well.
I'm not sure what you're asking me.
I'll talk with you later about it.
Okay.
Corleen Craft member. There's widespread concern about the void that will be left for your healthcare advocacy when you leave office. Do you have a plan to continue with that advocacy or policy making?
Well, one of the things I'm very interested in is playing some role in trying to frame the national health care debate for the 2004 presidential election, because if you look at what's happening in the healthcare system today, I mean, it is literally, I would say, within a couple of years of collapse. And it is, it employs, I think 14% of the nation's workforce is employed in the healthcare industry. And so the ripple effects on that are enormous. It is a much larger cost of doing business than PRS or workers' compensation, and it's just out of control. So there'll be a reaction, just as there was in 1992, and I think it would be it's valuable that the reaction actually gets to some of the core issues and dispenses with some of the sacred cows. Things like, I don't think you can change the system unless you go back and rethink the fundamental premises of Medicare and Medicaid. 37 years ago, those programs were enacted. It was a different world. The population demographics were different, and the delivery of health care was different. So I'm going to try to figure out some role to try to help do that in the next year and a half.
Governor Kitzhaber, my name is Moses Ross. I'm a City Club member, and I'm also on the Healthcare Issue Committee when we're formulating a paper or on doing research on this healthcare safety net. My question to you is there's one challenge that the health plan has had is within mental health. What do you feel are some solutions on a local tri-county basis? What do you feel are some solutions on a national level? And I'll let you address that.
Well, I think people need to, and I think the health plan has really helped us out with this. People need to recognize that mental health and physical health are both an integral and important part of wellness. And one of the things we did in the Oregon Health Plan was actually integrate the prioritization of mental health and chemical dependency services with our physical health services. And in mental health in particular, people need to understand that we will pay for people with mental disorders. We can do it one of two ways. We can pay for them by giving them early intervention so their problems don't escalate to crisis, or we can pay for them in our institutions, our criminal justice institutions or other institutions. We are doing, I could probably get together and spend a little more time talking to you on this. We're working very, very hard here in Multnomah County with Diane Lynn, and we are really, I think, beginning to turn around the situation with the mental health delivery system here in Multnomah County. But it requires a whole host of different strategies. For example, and on mental health issues, you have to be extraordinarily sensitive to cultural and ethnic issues. You have to have an understanding of that, or the system simply doesn't work. So it's part funding, but I also think it's part changing the premises and the nature of the delivery system, similar to what I think we need to do with physical health.
Governor Ken Ray, City Club member, I want to raise a question about the tobacco tax. Prior to the first session, you proposed the idea of raising the cigarette tax in Oregon by 50 cents a pack. We're currently one of the lowest cigarette tax states in the country, certainly the lowest on the West Coast. Yesterday, the Speaker of the House came out in favor of $1 a pack cigarette tax increase, which was something that he was very much opposed to prior to either of the first two sessions. Now, historically in Oregon, that cigarette tax money has been devoted solely to health care and to smoking cessation services, and we've rejected two ballot measures in the last couple of years to shift that money elsewhere. Should we, in this debate over needing new funding sources, be looking at the cigarette tax differently in terms of how it functions within our overall tax picture and what it funds long term?
Yeah, just two real quick comments. First, I do believe the cigarette tax revenue should be dedicated to two things: healthcare services and some to programs that help people stop smoking or prevent people from starting smoking. So I think that connection is an important one to keep. Whether it will, I don't know, but that's I believe that very strongly. Secondly, I support the cigarette tax increase, but I have some reservations with it. I mean, I support it primarily because it reduces the number of kids who start smoking in the first place, and that's basically the primary reason I support it. It's regressive, and the fact of the matter is, smokers didn't cause the recession. And I will support the cigarette tax, but that's why I think that we have to have some, even an incremental, broad-based tax component to this, because all of us need to put our shoulder to the wheel and help the state come out of this, not just people who happen to smoke.
Ewan Haldeman, City Club. If the people who could afford to privately educate their children did so, would this solve the public system's shortfall?
Well, I think this is a philosophical debate that's been going on for some time, and I think the real issue is if a family puts their child in other than a public school system, do they take their tax dollars with them? That's something I think people should, is that what you're saying?
I'm saying they don't take their tax dollars with them.
Right. Yeah, that's pretty much a description of the current system, and I think people should certainly have the opportunity to. I mean, my son right now is in the French American International School for a couple of years before we put him into the public schools. But I want to make sure that my tax dollars continue to support the public education system, because I think that's just the cornerstone. That's the great leveler in this country, equal access to public education, and I think it has to be a quality system so all kids of all incomes and backgrounds have an equal opportunities to succeed.
Tom Deering, a City Club member. Getting back to the structural problems in the tax system, and looking at the kicker, which is certainly an anomalous structural problem, and it's hard to be optimistic about getting it out. Is there some way that the approach to budgeting and forecasting could be used more creatively to make the triggering of the kicker either virtually impossible or much less likely than it has been in the past?
Well, I know that I believe Duncan Wise and some members of the Oregon Business Council are actually looking at a forecasting model, and I think that's one of the issues that they're discussing. I don't quite know how you would do it. I think that I would hope that when the larger tax restructuring debate reaches a point where we are looking at it seriously, that issue is raised again. I've definitely lost that debate every year since 1990, and now it's in the Constitution. But the troubling part of this is, if you don't change the forecasting model, like other states, when our economy recovers, generally what you do on a recovering economy is you take care of deferred maintenance and you make investments that you weren't able to make during the recession. Oregon won't be able to do that. I mean, if the economy grows faster than the forecast, that all kicks back. And when you have just the capital construction needs in our K through 16 system are immense in this state. So I think that issue has to be addressed, and it needs to definitely be a part of the debate in the next session.
Even though we have quite a bit more time, the governor does have to go to another appointment, so we'll just do one more question. Thanks.
This isn't a question. John, Ken Lewis City Club. I just wanted, on behalf of the people here, to thank you for your 8 years of service to this state. Thank you very much.
Thank you. The City Club is adjourned.